I'm Dr. Tom Zaleski, Professor of Audiology in the Audiology and Speech-Language Pathology undergraduate program. I am the Doctor of Audiology Program Coordinator. The purpose of this video is to help students who are considering the professions of Speech-Language Pathology and Audiology to explain the difference between them so they can make an informed decision on which path to pursue. One of the things that I find when talking to students, they don't recognize that in order to become an audiologist and/or speech-language pathologist, a graduate degree is required. In order to gain that graduate degree, there are specific courses that are required in the undergraduate arena that students must take. Here at Commonwealth University, we offer an undergraduate degree in audiology and speech pathology to provide the necessary foundations in speech, language, hearing, balance, voice, swallowing, in order to be eligible for graduate education or to be enrolled into a graduate degree in audiology and speech-language pathology. Individuals interested in speech-language pathology may not know and understand all the career options and paths that are available. Speech-language pathology really is a profession that serves individuals from birth to end of life. They can work with infants in early intervention, with infants who may have swallowing issues and feeding issues, to provide individuals background to support and develop speech and language. They provide services in preschools and schools to work with children who are having speech language issues, who may be having fluency issues or voice issues. They treat adults also with the same disorders, but also can treat individuals who have traumatic brain injuries or cerebral vascular accidents and have issues with swallowing and thinking and being able to develop the speech and language that is needed and necessary to communicate effectively and efficiently with others. Speech-language pathologists can also work on accent reduction for individuals who may be non-native speaking individuals. They may also work with individuals who have voice issues, coaches, cheerleaders, as well as singers who don't know how to work their voice appropriately. And so therefore, they work with them to reduce the issues or problems that go along with it. At Commonwealth University Bloomsburg, we have the Master's in Speech-Language Pathology program that provides the knowledge and skills and experience to make individuals eligible for licensure and certification to practice as independent, high-quality professionals. Audiology is truly a birth-to-grave profession where we start off by testing newborn infant hearing hours after birth, all the way to end of life, dealing with people who have hearing and communication issues. It is a clinical field, so not only is this field excellent for people in the audiology and speech-language pathology undergraduate program here, it is also an excellent pathway for people from biology, from chemistry, from the sciences, from psychology. Actually, we are trying to, or are positioning ourselves as the gatekeepers for hearing healthcare. We test the auditory system from the peripheral system all the way through the brainstem and up into the auditory cortex, as well as the vestibular system. We do evaluations, advanced valuations by monitoring the eyes. The eyes are the windows into the vestibular system, through more basic vestibular testing, having them look at things and maneuver things, to a rotary chair where we kind of spin people around to get more advanced testing done. We are one of the few programs in the country that offers a rotary chair, as well as a posturography system to evaluate balance. Balance is different than vestibular because it involves the vestibular proprioception as well as visual component of it put together. We also can do interventions for individuals. Individuals who have auditory processing issues, individuals who have tinnitus, We can do therapies to help them and training to help them overcome those problems. We can use devices. We can select assistive listening devices, both personal as well as room devices. We can select those, we can program those, we can troubleshoot those, we can teach individuals how to use them appropriately to overcome their hearing needs. The Commonwealth University Doctor of Audiology program has 3 individual tracks. One is the traditional audiology track, where you complete all of the Doctor of Audiology 4-year program. The research track is you complete the basic audiology and then you complete a independent research project under the direction of an audiology faculty, which adds 6 additional credits onto your program. The 3rd track is our interoperative neurophysiological monitoring track. This track is unique. We are one of the few programs in the entire country that offers the IONM track. IONM is actually developed through audiology, and it is a subspecialty within the Doctor of Audiology program. Students can also enroll in our 1-year post-baccalaureate certificate program in IONM to be trained to perform the duties and responsibilities of an IONM technologist. Interoperative neurophysiological monitoring is a profession where you are part of the surgical team. You are there to have better outcomes and to prevent injuries. So what the technologist does, they monitor the neural pathway to see is the signal getting from the brain or the spinal cord to the location to make sure the signal is getting there to prevent any problems and to prevent those issues and to speak to the surgeon to overcome those problems. Many students ask me, what is the big difference between the speech-language pathology program and the audiology program? I've had students also say to me that they would go the audiology route, however, they don't want to go 4 years after their bachelor's degree. Really, when you look at it, the big difference is really 1 year, and this is what people don't understand. Yes, the speech-language pathology program is a 2-year program. The audiology is a 4-year program. In order to get licensed and certified as a speech-language pathologist, you must complete a clinical fellowship year. That is after graduation. That is really our 4th year in audiology. When they revise the curriculum and the programs, one of the things that we found was individuals to come out and be set to really hit the ground running. So our 4th year is our CFY year. So when we think about it, really the only difference is 1 year. So there's 2 years of speech, 2 years of audiology, then audiology does a 3rd year, which is a combination of coursework and off-campus experiences, and then speech does their CFY year, which is our 4th year. So really the difference between the 2 programs is really 1 year. If you have more questions, please feel free to visit our website or to reach out to one of our faculty members who'd be more than happy to sit down with you and answer your questions and to provide more information about one of the professions.